Hi guys, how you doing? This is a short, sharp video on palliative care cases for the CSA. Why a video on palliative care cases? Firstly, it's something that people are scared about. Why? Because there could be hundreds of possibilities, hundreds of possible routes, loads of things to cover in a case like this, and obviously a very short space of time for 10 minutes. What are the possibilities? It could be obviously the patient themselves. It could be coming to see you in the surgery. It could be a home visit patient. It could be the relatives. It could be a carer. It could be a colleague case, a district nurse. It could be a palliative care nurse. The possibilities, like I say, are endless. And when you get so many possibilities, fear tends to kick in. And I remember preparing for palliative care cases myself for this exam, and it was stressful. You don't know what's going to come through the door. And if it does come through the door, what area am I supposed to tackle? Now, I'm an Arora, I'm a GP and a medical educator, and I hope to go through some of these things. Palliative care is one of the things that we're asked about in terms of making videos, probably the second commonest thing after genetics, and also at our courses as well. So let's try and get some of those key things out and make it a little bit more manageable for you so that you feel a little bit more confident. Let's start. So the first thing to work out in a palliative care case, I guess, is where in the palliative care journey are they? Now, they could be right at the beginning of the palliative care journey. They could have just found out the diagnosis. They could be scared about the future. They could be wanting to understand a little bit more about the diagnosis itself. So you have to be looking at letters, looking at notes, and trying to explain things in simple terms. It could be that they're a little bit further along from that point. They could have got over the diagnosis now, got over the understanding that this could be a terminal condition, and it's all about what is palliative care, what have we got to offer, what are the different types of aspects of palliative care, why is it so different perhaps to hospital medicine, what are the intricacies of that specialty that's called palliative care. It could be that they're a little bit further along, they're working on the decisions at the moment. Where do they want their final few days, weeks, months, hours to be? Is it at home? Is it a hospice? Is the debate between the pros and cons of either? Is it about explaining the possibilities of palliative care and what kind of things can be in place to make those kind of decisions a little bit easier? So it could be a decisions-based case, and it could be right at the end of their palliative care journey. So a home visit, perhaps you're going to see a patient who is in their final few hours, or within an hour to live, for example, and it's about thinking about what issues are important there, what sort of things we'll have to be focusing on. So I think it's really, really important, regardless of who comes to see you and what setting it is in a palliative care case, to work out what part of the palliative care journey are they based in. You can't cover everything, and it's about targeting to those specific issues depending on whereabouts in that journey they are. So the second thing I'd say to try and figure out pretty early in a palliative care case is, what type of palliative care case is this? What do I mean by that? I suppose there's 4 key different areas of palliative care that a case could go down. So it could be a physical type of case, for example. So it's all about symptom control, possibly, nausea, pain, constipation. There could be signs of significant pathology going on, metastatic back problems. It could be a real physical case. That could involve things like syringe driver prescriptions. That could involve things like writing up drugs in a certain way. What drugs can be combined with each other? How you can alleviate someone's physical symptoms. So that's one broad area of palliative care. A second broad area could be mental health within palliative care. Now, there could be patients who have become very anxious. Their anxiety levels are going up. Why? Because of fear of dying. It could be anxiety as to what's going to happen in the last few hours. It could be anxiety due to the future of family, for example. Guilt and things could be setting in. So there could be anxiety issues. And the other side, there could be mood issues. Depression is very common in palliative care, and the case could be revolved around how the physical symptoms are all in control, everything looks in place, but actually the patient's starting to show signs of depression, and it's about picking up those kind of signs, looking into those kind of issues, and seeing how you can help them from the mental health side of you. A third possible area could be the more spiritual or the emotional type of palliative care case. Again, physical symptoms might be fine. They might not be depressed, but there might be lots of questions going on in the patient's mind. Fear of dying, like we've already mentioned. What's going to happen in the afterlife? What's going to happen to my children after I move along? Am I leaving them with too much of a burden? Is there possibilities of bringing religious people involved? Is there any particular wishes that they have for their last few hours? Maybe that type of case might come up. And I suppose finally, you might get the more logistical or practical type of palliative care case, where you're talking about things like finances, talking about things like DS-1500s, talking about things like benefits. There could be issues like power of attorneys come into play. There could be things like wills that need discussing, DNAR forms. There's lots of logistical things that might come up as a GP when you see a palliative care case. So I think it's really, really difficult to try and cover all 4 of these areas in every single palliative care case that you do. And if you do try and do that, you're probably going to struggle and you talk at 100 miles an hour because you're trying to cover too much. So very early on, maybe sort of glance over these 4, work out what the key issues seem to be, and then maybe target towards that one particular area. Because in that way, you look a lot more focused, you'll probably cover a lot more, and you'll be able to be a little bit more patient-centered, which is what palliative care is all about. The third thing I said to focus heavily on in a palliative care case is listening. Now, listening, of course, is very important as a GP in all cases, of course it is, but in a palliative care case, it is imperative. You've got to give them space in a palliative care case. You've got to allow the patient to expand on thoughts, feelings, ideas, things that are going to come out if you give them a chance. Often when we're under stress, we're under panic situations, we rattle off things, ask about this symptom, that symptom, how's your mood, ask about who's involved, carers, and it can just all come out 100 miles an hour. Now that might be all very relevant information, but actually you've not allowed the patient to give you anything off their own back. And often in palliative care, listening is so important. Active listening, nodding, all the things that we've talked about in previous videos, they become really, really important in these types of cases. So really pay attention to listening. Allow the role player to expand on things that they want to expand on. Sometimes they need a bit of time for this, and don't rattle off at 100 miles an hour. Your time will come. They'll give you space. They'll give you opportunities to clarify things, take things forward, ask your own questions. But please don't underestimate the importance of really clear, focused listening when it comes to palliative care cases. And the final tip I'm going to give you guys in terms of palliative care cases is not to forget the holistic or multidisciplinary or multifactorial type of approach that palliative care is all about. It's not just about what you're going to go in and do as a sole GP. What drug am I going to prescribe? What service am I going to refer you into? Of course, that's one part of palliative care, but don't forget to involve all the other people that you can involve in palliative care. So I suppose you've got things like relatives first. Of course, you want to find out about relatives. What kind of things, how are they feeling? Do they need extra support? Are they members of the practice? What do they feel? How involved do they want to be? How involved does the patient want the relatives to be? So relatives are a key part. Other carers, might be external carers arranged by social services. Don't forget to involve them and to sort of show that you're going to involve them in your care and make them understand what kind of issues are going on and how they may need to help the patient. Don't forget to involve people like the district nurses. Are obviously going to be a key part of a lot of palliative care cases, particularly those that are based at home. Don't forget to involve the palliative care nurses. They're going to be an integral part and often know so much more than we do, have so much more experience than we do when it comes to palliative care cases. Things like pharmacists are important to involve in terms of getting medication set up, getting prescriptions done, out of hours, informing them about palliative care cases so that if something happens when the surgery is closed, they're aware of all the details that are going on. There could be physios, there could be OTs making adaptations to the houses. There could be so many different people involved in a palliative care case. So remember not to be too narrow focused. Don't go in the, well, I can do this. It's about getting everyone involved, spreading it all out, making it a holistic approach, making it a multifactorial approach. And apart from probably elderly social care, I suppose this is probably one of the most multifactorial type of cases that you're going to get. So don't forget the other people involved and make it all about yourself. So guys, I hope that's been of value to you. Hopefully you've realised that palliative care doesn't have to be as stressful as we often think. And a couple of simple things, making sure you work out where in the palliative care journey they are early on. Make sure you work out what type of palliative care case it is early on. Make sure you show active listening, allow the role play to guide you as to where the important bits are. And finally, not to do everything yourself and to think about everyone else in that palliative care team. Now, there's lots of other things about palliative care, and we cover a lot of these things at our courses and our mocks. But if you have any particular specific areas that you want me to produce videos on, and we get a lot of these days, please email me, please tweet me, get in touch via the website. The details should be all down below here. If I do get to meet you in the future, fantastic. If I don't get to meet you and you're taking the exam in the next couple of months, then good luck. I'm sure you'll be great. Subscribe if you find these videos useful, but hopefully I will see you guys again some point soon.